The wake-up call you can't ignore. The one secret to thriving in your golden years. You see every year not just thousands, but hundreds of thousands, even millions of heartbreaking stories, quietly unfold across our communities, all because we missed crucial golden signals that our bodies were desperately trying to send us. Here's a stark reality, one that often goes unsaid, but as someone deeply involved in healthcare, especially with older adults, I feel compelled to share with you candidly. Over 70% of cancer cases in older adults are only diagnosed in their late stages. Over 70%! That number is truly sobering and demands our attention. It means that by the time the disease truly speaks out with persistent pain, extreme fatigue, or severe debilitating complications, the chance for a complete cure, for reclaiming a full healthy life becomes incredibly slim. The most tragic part, the part that keeps me up at night, is this. Most of those warning bells had already rung within their bodies much earlier, but due to complacency, due to mistaking them for common aches and pains of aging, or simply because we haven't learned how to read our body's language, we miss that critical window to act. I've witnessed far too many regrets, and I am determined that none of you watching this video will have to experience that heartbreak. But today, I want you to know, this concerning situation can be changed. We will no longer let precious signs go unnoticed. We will no longer let a lack of knowledge hinder us from protecting our beloved elders. In this special video, I will join you in uncovering the most important secret to your golden years, a collection of essential knowledge and practical wisdom drawn not just from reputable medical texts, but also from real-life experiences. This will help you not only identify the earliest, most subtle silent enemies of health, but also actively defeat them right from their initial stages, when they are weakest and most vulnerable. This is truly my heartfelt effort, a message from my heart, with the fervent wish that every parent and grandparent among us can live a healthy, fulfilling, and peaceful life, enjoying their happiest years surrounded by their children and grandchildren. Specifically, in the next few minutes, we will explore crucial and more vital topics than ever before. First, I will show you 7 of the earliest warning signs of cancer that you absolutely must commit to memory, that you must check for yourself and encourage your loved ones to be aware of, so no one ever has to regret overlooking them. These are the persistent calls your body makes for attention. 9. Each piece will secret to detecting cancer very early, even before you feel any pain or obvious abnormalities. It's like having a personal doctor constantly monitoring and protecting your health from within. And most importantly, we will discover simple yet surprisingly effective actions, daily habits you can adopt immediately to proactively prevent cancer, helping you achieve a healthy, peaceful, and joyful old age. Please, I urge you to stay with me until the end of this video, because I firmly believe that just a few minutes of listening today, a small investment in your own health, will equip you with the key to protect not only yourself, but also the happy future of your entire family. Don't miss out. This information truly has the power to save a life, to preserve a lifetime of happiness. 7 earliest warning signs of cancer. Now, let's delve into the core, the most crucial part of this video, identifying the 7 signs that your body might be trying to tell you, might be sending you important alerts about the risk of cancer. With all the medical knowledge I've gathered in the healthcare field, especially from real-world experience interacting with thousands of patients and their families, I genuinely hope you will listen very carefully and commit these points to memory as a personal recommendation from me to you. These are truly invaluable pieces of information that can help you and your loved ones protect your health proactively and most effectively. Unexplained weight loss. The first sign we need to pay very close attention to, and often the one that many older adults or even younger individuals with elderly family members tend to overlook the most, is unexplained weight loss. Think about it. You're still eating regular meals, maybe even eating more than usual because you're worried about getting thin or because your family is trying to get you to gain weight. You're maintaining your usual activities, not intentionally trying to lose weight, and certainly not engaging in strenuous exercise. Yet, you find yourself visibly losing weight. Your clothes start feeling noticeably looser than before. Specifically, if you experience a loss of more than 5% of your body weight within a period of 1 to 2 months without any clear medical reason. For instance, if you weigh 150 pounds and you unexpectedly lose 7.5 pounds or more within just 8 weeks, and it's not due to a common cold, a temporary digestive upset, or a deliberate dietary change, then this is a very significant red flag that you absolutely must pay attention to and not dismiss lightly. So why might cancer cause weight loss? When cancer cells begin to form and grow inside the body, they act like silent, highly sophisticated thieves. They not only multiply rapidly, but also demand a large amount of energy and nutrients to sustain their life and their accelerated growth. This process significantly alters how your body processes energy. Instead of using energy to maintain normal functions, your body is forced to feed the growing tumor. This can make it difficult to gain weight or even cause rapid weight loss, regardless of your appetite. Furthermore, some types of cancer can release inflammatory substances into the bloodstream, which can disrupt your appetite, leading to a lack of hunger or diminished enjoyment of food, or directly affect your gut's ability to absorb nutrients efficiently, meaning the food you eat isn't properly utilized. Unintended, unexplained weight loss can be one of the first and most crucial signs of various cancers, particularly those that directly impact your digestive system and how your body absorbs nutrients, such as liver cancer, stomach cancer, pancreatic cancer, esophageal cancer, colorectal cancer, or even lung cancer and ovarian cancer. In my professional experience, I've seen numerous cases where patients came in solely because of uncontrollable weight loss, and after thorough examination, doctors discovered cancer in its early stages, providing a much higher chance of successful treatment. That's why I strongly advise you and your family members never to simply assume, "Getting thinner is normal with age," or "I just don't have an appetite." Please, listen to your body's signals seriously and act proactively. 2. Remove fatigue even after rest. The second sign that warrants our special attention, and one that is often easily mistaken for the normal weariness of aging, is a feeling of persistent, overwhelming fatigue that lingers even when you've had plenty of rest. Please note, this isn't the typical tiredness you feel after a long day of chores, a busy trip, or even a single night of poor sleep. This is a state of extreme exhaustion, a feeling as if your entire body has had its battery drained, leaving you constantly listless and devoid of energy. You might have tried to get enough sleep. You've rested extensively, perhaps even spent a whole day resting, yet you simply can't seem to regain your strength or mental alertness as you would normally. This uncomfortable fatigue can make you lose interest in everything, from beloved hobbies like reading or watching movies, to seemingly simple daily activities such as cooking, walking around the house, or even just talking on the phone with family. Everything feels like an immense effort and becomes much harder than it used to be. Cancer-related fatigue is often distinct and has specific characteristics. It can arise for several complex reasons. Firstly, rapidly growing cancer cells can release inflammatory substances into your bloodstream. disrupting normal biochemical processes in your body and causing this chronic weariness, even if you're not physically exerting yourself. Secondly, cancer can lead to anemia, a condition where your body doesn't produce enough healthy red blood cells to carry essential oxygen to your cells and tissues. When you lack oxygen, you'll constantly feel pale, short of breath, and profoundly exhausted. Thirdly, simply put, your body is expending immense energy and reserves to fight these abnormal cells that are growing within you, like a silent, ongoing battle you might not even be aware of. This unusual and persistent type of fatigue is often an early sign of blood cancers, such as leukemia and lymphoma, or other cancers that are progressing and have begun to affect your body systemically. I firmly believe that every older adult in our families deserves to enjoy an active, healthy, and joyful life, surrounded by their loved ones, rather than being limited by this unexplained, abnormal fatigue. So please never dismiss or ignore this sign. Don't hesitate to share this feeling with your family and see a doctor right away to find out the true cause. Early detection is key. 3. Persistent cough, hoarseness, or shortness of breath. Let's discuss the third sign that requires your special attention. A persistent cough that won't go away. A voice that becomes unusually hoarse and lasts for an extended period. Or experiencing shortness of breath more easily than before. Typically, when we cough, our first thought is a common cold, seasonal allergies, or perhaps a minor throat irritation. However, if your cough continues relentlessly for more than 3 weeks without any clear reason, and common cold medications don't offer relief, or if it's accompanied by a distinctly hoarse voice, a persistent, raspy quality, or unusual shortness of breath, even during light activities like walking around the house, talking on the phone, or even when resting. These are significant red flags that you absolutely cannot afford to ignore or brush off. These persistent and unusual symptoms are often early warning signs of cancers that directly affect your respiratory tract, lungs, bronchial tubes, or the throat area where sound is produced. For example, they could be indicators of lung cancer, laryngeal cancer, nasopharyngeal cancer, esophageal cancer, or even thyroid cancer. When a malignant tumor appears in these vital locations, it can irritate the airways, cause chronic inflammation, meaning long-lasting inflammation, directly press upon the nerves that control your voice, known as the laryngeal nerves, or narrow your air passages, leading to these uncomfortable and lingering symptoms. It's especially crucial to be vigilant if you or someone in your family has a history of smoking, including secondhand smoke exposure, or if you live in an environment with significant air pollution, dust, or chemical exposure, as these factors significantly increase the risk of cancers related to the lungs and respiratory tract. As someone deeply concerned with public health and keenly aware of the destructive nature of cancer, I urge you to be extremely cautious with this particular sign. Please, do not hesitate or delay seeing a doctor to determine the exact cause and receive timely intervention. Every delay could mean a missed opportunity for effective treatment. 4. Unusual changes in bowel or bladder habits. The fourth sign, a topic that might seem personal and often gets overlooked due to embarrassment, yet is incredibly important for us to monitor closely. Unusual changes in your daily bowel or bladder habits. This can manifest in various forms, from subtle shifts to more obvious symptoms. It could be persistent, unexplained diarrhea or constipation that alternates or lasts for many days without a clear reason, not related to a change in diet or new medication. It might be seeing blood in your stool, either bright red blood on the surface of the stool, or stool that appears dark and tarry, like coffee grounds, indicating digested blood from higher up in the digestive tract. It could also be urine that suddenly looks unusually dark for an extended period, or you clearly see blood mixed in your urine. Furthermore, you might find yourself needing to urinate much more frequently than usual, especially waking up many times at night to use the restroom, or experiencing painful urination, a burning sensation, or feeling like your bladder isn't completely empty after urinating. These changes, however minor they may seem at first glance, can be crucial messages from vital organs in your digestive or urinary systems. For instance, blood in the stool, whether fresh or dark, significant and prolonged changes in bowel habits, or discomfort during bowel movements are very important early warning signs of colorectal cancer or rectal cancer. Dark urine, jaundice, yellowing of the skin and eyes, or unexplained generalized itching could be related to liver or bile duct issues, which might include liver cancer or pancreatic cancer. And for men, increased urinary frequency, difficulty urinating, or particularly frequent nighttime urination can be a sign of prostate cancer, although these symptoms can also be caused by benign conditions like an enlarged prostate. I understand that sometimes we might feel uncomfortable discussing these personal matters, or consider them too private to share. But please, dear friends, do not be shy or keep these symptoms to yourself. From a medical perspective, and based on my practical experience, even the smallest pieces of information can provide invaluable clues for doctors to pinpoint the true cause, make an accurate diagnosis, and initiate timely treatment, potentially turning a challenging situation around. Be brave and share your concerns with your doctor to get the best advice. 5. A sore that doesn't heal, or a mole that changes. The fifth sign that we need to be particularly attentive to and regularly check for ourselves is a sore or lesion on your body that simply won't heal, or a mole that suddenly seems unusual or changes its shape or color in an abnormal way. Any sore or wound on your skin or in your mucous membranes, like inside your mouth, on your tongue, gums, tonsils, or in your genital area, that persists and fails to heal after 2 to 3 weeks, despite proper hygiene or attempts at common remedies, needs to be taken seriously. Similarly, if you have an existing mole that you've had for a long time, or if a new mole suddenly appears on your body, and you notice any unusual changes in its size, it rapidly grows larger, not following normal patterns. Its shape becomes asymmetrical, irregular or uneven on both halves. Its color becomes much darker, has multiple colors, or changes color abruptly. Or if it suddenly starts to itch intensely, become painful, bleeds easily with minor contact, or its surface becomes rough or raised, then you absolutely must not dismiss these signs lightly. These are clues that even a non-medical person can often recognize by sight and touch. These alarming changes can be early warning signs of skin cancer, especially melanoma, a very aggressive form of skin cancer if not caught early. Oral cancer, tongue cancer, tonsil cancer, or other cancers affecting mucous membranes. Skin cancer is one of the most common types of cancer in older adults, particularly for those with a history of significant sun exposure or who work outdoors without adequate sun protection. However, the good news is that if detected at a very early stage, the cure rate is often very high, even complete eradication of the tumor. That's why I always encourage you to regularly perform self-checks of your skin and mucous membranes. take a few minutes to look closely in a mirror, or ask a family member to help you examine hard-to-see areas like your back, scalp, between your toes, or under your nails to catch these unusual signs as early as possible. A little bit of meticulousness and caution today could save your life tomorrow. 6. Persistent unexplained pain in one area. The sixth sign we need to pay very close attention to is a persistent dull ache or pain in a specific part of your body that has no clear explanation and just won't go away. Please understand, this is not a sharp, acute pain or intense pain from bumping into something, falling, or overexerting yourself. Rather, it's a mild, nagging discomfort that is constant, lasting for many weeks or even months without relief. It doesn't get better with rest, hot-cold compresses, or common over-the-counter pain relievers. And in fact, it might even gradually worsen over time, or become more severe at night. Common locations where this type of pain might appear include your abdomen, upper or lower, your back, lower back pain, upper back pain. Bones and joints, especially large joints like the hip, shoulder or spine. Or a persistent, unexplained headache that doesn't resolve with typical headache remedies. While pain is often a symptom of cancer in more advanced stages, when the tumor has grown larger, is pressing on organs, or has metastasized to other parts of the body. In some specific cases, pain can still be an early sign of certain cancers. For example, it could indicate bone cancer when the tumor forms directly in the bone. Cancers originating from soft tissues, like muscle or fatty tissue tumors. Pancreatic cancer, which often causes persistent back pain or upper abdominal pain that radiates to the back. Or brain cancer, leading to a persistent, unremitting headache, often accompanied by other neurological symptoms like nausea, dizziness, or changes in vision. As cancer cells grow uncontrollably, they can directly press on surrounding nerves or invade and destroy nearby tissues and organs or release inflammatory substances into the bloodstream. All these factors can lead to this type of uncomfortable pain. From my perspective as someone who understands the nature of diseases and their consequences, I sincerely urge you never to underestimate chronic, persistent pain, especially when you cannot explain its cause and it doesn't respond to typical pain relief measures. Please see a doctor immediately to find out the true culprit behind that pain. Don't let it linger and affect your quality of life. The seventh sign, but also one of the most easily recognizable signs that you can both see and feel with your hands. Suddenly noticing a new lump, an unusual bump, or an area of swelling under your skin that wasn't there before. This is a sign you can often easily feel by gently touching and examining your body. Key areas that you should pay special attention to when checking include the area under your neck, where many lymph nodes are located, your armpits, your groin, your breast-chest area. This is an extremely important area for both men and women to check, or any area on your abdomen or limbs. This lump might not cause pain when you touch it. It could move freely under the skin or be fixed in place, and it might feel soft or hard like a rock. Its size can range from very small to quite large. Any new lump or swelling that you discover on your body, regardless of whether it causes pain or how small it is, should be examined by a doctor as soon as possible. Do not put off seeing a doctor assuming no pain means no problem, or it's probably just a benign lump. These unusual lumps or swollen areas can be warning signs of various types of cancer, such as lymphoma, when lymph nodes in the neck, armpit, or groin enlarge abnormally. breast cancer, especially common in women, but can also affect men, though less frequently. Thyroid cancer, a lump in the neck area, or other cancers that are forming or have spread to nearby lymph nodes. Regular self-breast exams for women, following detailed instructions from your doctor on how to perform them, and frequently checking for lumps in your lymph node areas on your body are extremely important to catch these signs early. In my medical experience, detecting a lump early often leads to a much better prognosis and a significantly higher chance of successful treatment. So please, don't let it grow and create a larger, more difficult to manage problem. To all my dear viewers, I want to emphasize one final crucial point in this section. A point I always hold dear and want you to remember. The signs we've just discussed are vital warning signals, well worth your serious attention and high vigilance. However, please do not self-diagnose, do not jump to conclusions, and do not panic assuming you definitely have cancer. Many benign conditions, common illnesses, or even normal bodily changes can cause similar symptoms. However, the main purpose of this video is to empower you with knowledge to recognize and be proactively vigilant, not to provide self-diagnosis or replace the advice of a qualified medical professional. Always trust science, trust medicine, and seek immediate medical attention if you have any health concerns about yourself or your loved ones. Because sometimes even a delay of just one day can significantly reduce your chances of successful treatment, making the journey much harder. And I, with all my understanding of disease, with all my passion, do not want you to go through that. I do not want anyone to regret procrastinating or neglecting their health. Knowing how to recognize early signs is incredibly valuable, but is there a way to detect cancer even when you don't feel any obvious symptoms or pain? With the remarkable advancements in modern medicine today, I can confidently tell you, yes, absolutely. And that's thanks to proactive routine health checkups and cancer screenings. A concept that might sound complex, but is actually very accessible and essential for your golden years, for the healthy life of each and every one of us. Have you ever wondered why cancer seems to favor older adults more? As I've deeply researched this disease and interacted with countless patients, I've come to understand a very simple and scientific truth. It's the natural aging process of our bodies. You see, over time, our bodies are much like machines that have been running for many years. Our cells, after decades of continuous operation and exposure, can accumulate minor wear and tear. Random mutations or errors in their genetic code, DNA, due to natural aging and constant exposure to environmental factors, like sun exposure, harmful chemicals, pollution. Simultaneously, our immune system, which is our body's protective army, sometimes becomes less sharp and effective than it was in our younger years at identifying and eliminating abnormal cells, even precancerous cells, right when they first emerge. That's why proactive visits and healthcare become more important and necessary than ever as we get older. This isn't something to fear, or to make us think that cancer is an inevitable fate of old age. On the contrary, understanding our bodies helps us act proactively, and science has clearly proven that our proactive efforts can significantly change this outcome, helping us live much healthier and more fulfilling lives. Dear friends, once again, I earnestly urge you, please do not wait until your body speaks out with clear, painful symptoms, or until you feel so uncomfortable that you can't bear it any longer, before rushing to the doctor. especially once you've crossed the age of 50. Routine screenings become an incredibly vital golden shield, an invaluable health insurance policy, providing immense peace of mind and significantly increasing your chances of successfully overcoming illness. I always believe that prevention is better than cure, and from a professional medical standpoint, this is truly the most effective and proactive way to prevent cancer, bringing long-lasting and sustainable benefits to your health. Please keep this in mind. It's a common misconception. While annual general health checkups are excellent for monitoring basic vital signs like blood pressure, blood sugar, cholesterol levels, liver and kidney function, and cardiovascular health, to specifically look for early signs of cancer, especially tiny abnormal cells that are invisible to the naked eye, we need more specialized screening tests. These tests are designed specifically to detect abnormal cells or precancerous lesions even before any symptoms appear. Don't confuse these two concepts, and please be assertive and discuss with your doctor your desire for cancer screenings. Clearly state your concerns so your doctor can recommend the most appropriate tests based on your age, gender, personal medical history, and family medical history. Below are some standard cancer screening tests and methods recommended by reputable health organizations in the United States that you should discuss with your doctor to have done regularly depending on your age and individual risk factors. These methods have all been scientifically proven to be effective and safe. Cloak. Colorectal cancer screening. This is one of the most common cancers in older adults in the US. However, the good news is that if detected at an early stage, when the tumor is very small or only precancerous polyps, the cure rate is very high, often over 90%. Cloak. This is considered the gold standard for colorectal cancer screening. A doctor inserts a thin, flexible tube with a camera into your colon to directly visualize the inside. They can identify and immediately remove polyps, small benign growths that can develop into cancer, before they turn malignant. It's generally recommended starting at age 45, recently lowered from 50 by organizations like the American Cancer Society, and then repeated every 5-10 years depending on the results of the previous colonoscopy. It might sound a bit daunting, but the procedure is very safe, usually performed under light sedation so you don't feel discomfort, and offers extremely effective health protection. Fecal immunochemical test, FIT, or fecal occult blood test, FOBT. These are simpler, non-invasive tests that you can often perform at home. They detect tiny amounts of blood in your stool that aren't visible to the naked eye. Blood in the stool can be a sign of bleeding polyps or cancer. If the result is positive, your doctor will likely recommend a colonoscopy for further investigation. These tests are typically recommended annually. Stool DNA test, e.g. Cologuard. This is a newer test that looks for specific DNA mutations associated with cancer in cells shed in your stool. It's less invasive than a colonoscopy and can be done at home. If positive, a colonoscopy is usually recommended. Frequency varies, often every 1 or 3 years. Lung cancer screening, especially crucial for individuals with a history of heavy smoking, current smokers or those who have quit within the last 15 years, and those with significant exposure to secondhand smoke or polluted environments. Low-dose CT scan, LDCT. This is a specialized imaging technique that uses a very low dose of X-rays to create detailed images of your lungs. It helps doctors detect small tumors or subtle nodules in the lungs that might be missed on a standard X-ray. If you fall into a high-risk group, e.g., typically adults aged 50 to 80 with a 20-pack-year smoking history and who currently smoke or have quit within the past 15 years, as per American Cancer Society guidelines, discuss annual LDCT screening with your doctor. Prostate cancer screening for men. This is one of the most common cancers among men. Prostate-specific antigen, PSA blood test. PSA is a protein produced by the prostate gland. Elevated PSA levels in the blood can be a sign of prostate cancer, but can also be due to other benign conditions like prostate inflammation or benign prostatic hyperplasia, BPH. Your doctor will interpret the results based on your PSA level, age, and other factors to determine if further testing is needed. Digital rectal exam, DRE. Your doctor will manually examine your prostate gland to check its size, shape, and texture for any abnormalities. Screening usually starts around age 50 for average-risk men, or potentially earlier, e.g., age 40-45, if you have higher risk factors, such as a strong family history of prostate cancer in close relatives diagnosed at a young age. The decision to screen is a shared one between you and your doctor. Breast cancer screening for women. This is one of the most common cancers among women. Mammogram. This is a specialized X-ray of the breast that helps detect early tumors, abnormal calcifications, or other changes in breast tissue that you might not be able to feel. Recommendations vary slightly by organization, but generally, yearly mammograms are recommended for women starting at age 40 to 45 and continuing annually until age 55, then potentially every 2 years or continuing annually as long as they are in good health. Clinical breast exam, CBE, by a doctor. Your doctor will visually and manually examine your breasts and lymph node areas in your armpits and neck for any abnormalities. Self-breast exam, SBE. While not a substitute for mammograms, performing regular self-breast exams, following your doctor's instructions, helps you become familiar with the normal feel and appearance of your breasts, enabling you to detect any unusual changes early on. Breast ultrasound and breast MRI may be ordered as supplementary tests if there's a suspicious finding, or for women with dense breast tissue or very high risk factors. Cervical cancer screening for women. Pap test, pap smear. This test helps detect abnormal or precancerous cells on the cervix. It's generally recommended to start around age 21 and performed every 3 years. HPV, human papillomavirus, test. HPV is the virus responsible for most cervical cancers. This test looks for the presence of high-risk HPV types for women aged 30 and older. Co-testing, pap test and HPV test together, is often recommended every 5 years. Other general tests that may suggest cancer. Complete blood count, CBC. While not a specific cancer test, it can help detect indirect signs like anemia, often linked to bleeding in the digestive tract from cancer, or abnormalities in blood cell counts or appearance, suggesting blood cancers like leukemia or lymphoma. General abdominal ultrasound can help detect masses or abnormalities in internal organs like the liver, kidneys, pancreas, or ovaries, though its accuracy for diagnosing specific cancers isn't as high as specialized methods. It can provide clues for further, more targeted testing. Regular physical exams. Your primary care physician is a crucial partner in your health journey. Regular checkups allow them to... Please, my dear friends, keep this deeply in mind, because this is heartfelt advice from someone who understands disease and has witnessed countless cases. Detecting cancer in its early stages dramatically increases the chances of survival and cure. In many cases, patients only require a simple surgery to remove the tumor or a few rounds of less intensive chemotherapy/radiation with fewer side effects to achieve a complete cure and return to their normal lives. Throughout my career, I've seen countless success stories, patients who have overcome cancer and returned to active, healthy lives, enjoying their days with family. All thanks to early detection. That's why I earnestly urge everyone never to be complacent, never to hesitate to invest time, effort, or even financial resources into routine health checkups and screenings. Because this is the ultimate way to show love and care for yourself and your family. It is truly one of the most worthwhile investments you can make for your golden years. Prevention. Small daily actions, big lifelong happiness. Beyond actively detecting cancer through screenings and regular checkups, I firmly believe that we can all proactively prevent cancer through simple, easy-to-do actions that, when done consistently, are incredibly meaningful and yield surprisingly powerful results every single day. These aren't just general health tips. These are scientifically proven habits and lifestyles, validated by numerous reputable medical studies worldwide, shown to be truly effective in significantly reducing the risk of cancer. Let's delve into each specific action. Eat smart, eat well. Turn your meals into a protective shield for your health. Minimize red and processed meats. Extensive scientific research has indicated that consuming large amounts of red meat, like beef, pork, lamb, and especially processed meats, such as sausages, hot dogs, bacon, deli meats, can significantly increase the risk of various cancers, particularly colorectal cancer. Try to replace these with healthier protein sources like fish, salmon, tuna, rich in omega-3s. Lean poultry, chicken, turkey, without the skin, or abundant plant-based proteins like tofu, lentils, and nuts, almonds, walnuts. Limit sugary drinks and processed foods. Sugar and sugary beverages don't directly cause cancer, but excessive consumption leads to weight gain, obesity, and insulin resistance, factors that, in turn, increase the risk of many different types of cancer, including breast, colon, and pancreatic cancers. Processed foods often contain high levels of preservatives, additives, salt, sugar, and unhealthy fats, which are detrimental to overall health and can contribute to increased disease risk. Increase fresh vegetables and fruits daily. These are your body's natural superfoods. Fresh vegetables and fruits are rich in essential vitamins, minerals, and especially powerful antioxidants. These silent warriors help protect every cell in your body from DNA damage, a key factor in cancer initiation, thereby preventing the formation of cancer cells. Aim to eat at least 5 servings of colorful fruits and vegetables every day to maximize your nutrient intake. Prioritize whole grains over refined grains. Foods like brown rice, oats, whole wheat bread, corn, and sweet potatoes provide abundant fiber, which promotes a healthy digestive system, helps regulate blood sugar, and significantly reduces the risk of colon cancer. Incorporate cancer-fighting foods. Include foods renowned for their anti-cancer properties, such as turmeric, containing curcumin with strong anti-inflammatory, antioxidant, and anti-cancer properties. Broccoli, cauliflower, cabbage, containing sulforaphane, which aids detoxification. Green tea, rich in EGCG, a powerful antioxidant. Tomatoes, rich in lycopene, beneficial for prostate health and other cancers, and various berries, strawberries, blueberries, raspberries, rich in anthocyanins with strong antioxidant capabilities. Make these foods an indispensable, delicious, and nutritious part of your daily meals. Regular, moderate exercise. Energize your body and mind. You don't need to engage in strenuous gym workouts or exhausting runs. Just 20 to 30 minutes of brisk walking each day. For example, walking around a local park, walking to the grocery store, or taking a leisurely stroll in your neighborhood, or practicing gentle tai chi, yoga, simple stretching, or even joyful gardening and house chores with mindful movement is enough to improve blood circulation, boost your immune system, and significantly reduce cancer risk. Regular physical activity helps maintain a healthy weight, avoiding obesity, a major cancer risk factor, reduces chronic inflammation in the body, and enhances your immune system's function. Make physical activity an indispensable part of your daily routine, viewing it as a pleasurable activity, a way to relax and connect with nature, rather than a burdensome task. Prioritize consistent, sufficient sleep. Recharge and repair your body from within. Sleep is not just a time for physical rest, it's when your body repairs itself, mends damaged cells, and regenerates energy for a new day. Studies have shown that chronic sleep deprivation, insufficient sleep, or poor quality sleep can significantly weaken your immune system, making your body more vulnerable to various diseases, including the development of cancer cells. Try to maintain a habit of getting 7-8 hours of quality sleep each night, and strive to go to bed and wake up at consistent times to regulate your body's internal clock optimally. If you experience persistent sleep difficulties, insomnia, trouble falling asleep, restless sleep, seek to understand the cause and address it early. Sometimes, simple lifestyle adjustments or consulting a doctor can lead to significant improvement. Maintain a positive outlook, embrace optimism, and manage chronic stress. Peace of mind, all things are well. Chronic stress not only drains your mental energy, but also has a profoundly negative impact on your immune system, weakening your body's natural defense mechanisms. This, in turn, can create favorable conditions for diseases, including cancer, to develop. Find personal ways to manage stress and maintain a calm mind, such as meditation, reading, listening to your favorite music, talking openly with family and friends, spending time in nature, or joining senior clubs and community activities. An optimistic, joyful, and peaceful mindset is truly the most valuable tonic for your physical and mental health. Avoid harmful substances and polluted environments, a shield for every precious cell. Strive to minimize your exposure to tobacco smoke, whether directly smoking or inhaling second-hand smoke. Second-hand smoke is equally dangerous and a leading cause of lung cancer. Air pollution from traffic and factories, and strong chemicals in your living and working environment. For example, pesticides, industrial cleaning agents, asbestos. These are enemies scientifically proven to cause DNA damage to cells and lead to cancer. If you live in a polluted area, try to protect yourself. Wear a suitable mask when outdoors. Use an air purifier indoors if feasible. Keep your home clean and well ventilated. Dear friends, every small thing you do today, every healthy choice you make, that is a huge protective step, an investment that will never lose value for your precious health and the well-being of your loved ones in the years to come. With all the knowledge I've gained and the experiences I've observed, I affirm that anyone can do this. All it takes is a little determination and consistent effort. Please, transform this knowledge into concrete actions to protect yourselves for a healthy and fulfilling life. To my dear viewers, as we wrap up today's video on cancer in older adults, I sincerely hope you remember this. Cancer is not a death sentence. Thanks to the remarkable advancements in modern medicine, many types of cancer, when detected early, can be cured or effectively managed, allowing patients to live healthy, fulfilling lives alongside their loved ones. Just imagine, by simply listening to your body and being proactive with screenings, a tiny seed of cancer could be discovered and removed in time. before it has a chance to grow or cause harm. That small action could preserve your joy, peace, and quality of life. And to the younger generation, please, show more care and attention to your parents and grandparents. Sometimes, just a thoughtful question or a few kind words is all it takes for them to open up about their health concerns. Be the first line of protection for their well-being. In short, never ignore any signal from your body. The right knowledge and timely action can truly save a life. Thank you for staying with me until the end of this video. If this message touched you, please share it with those you care about, because one small action today could change someone's tomorrow. And don't forget to subscribe to the channel so you won't miss out on our upcoming helpful health content. Wishing you and your loved ones good health, peace, and happiness. See you in the next video.